45 years of leadership, innovation, and commitment, Kempe has established itself as a global leader in the prevention and treatment of child abuse and neglect. It all started with the inquisitive nature and compassion of Dr. C. Henry Kempe.
As he was attending to children in the emergency rooms in the 1950s, as he saw children coming in with broken bones and other injuries, and then hearing the explanation as to how those injuries happened, Dr. Kempe said, well, maybe not so much. So he started asking more questions and looking a little bit deeper into what was going on.
He'd been seeing the problem of child abuse and neglect for more than 10 years and could never quite get people to pay attention to it until he coined, I guess, what would be referred to as a little bit of a salacious title, the battered child syndrome.
When you look at all the professionals that have come through Kempe in the last 45 years, you look at the work that they have done, you look at how that work has been disseminated around the country and around the world, and the difference they've made in the lives of not hundreds, but thousands of children, it is a very rich history. And I'm happy to say that that history continues today.
The next 45 years will continue to build on and expand on that foundation. Training programs are preparing professionals, parents, and families how to better protect our children and provide safe, healthy, and nurturing homes. Programs like the Colorado Child Welfare Training System, Safe Care Colorado, and Fostering Healthy Futures.
The Child Welfare Training System is the core training system or academy for new social workers to learn how to do child protective service work in their counties.
Our program was started here at the Kempe Center just about 5 years ago now, because the governor intended for us to create the nation's very best child welfare training system so that, again, our child welfare workforce can be retained and competent, and the work that they do can be sustainable in service of kids and families.
And we're doing it better than anybody now. We're doing a really, in my biased view, probably the best job in the country of training new child protective service workers to do their job.
We are a home visiting program for families that have a lot of risk factors for abuse, and we work to teach them parenting skills and empower them as parents.
We started the delivery of Safe Care in early 2014, and the first 3 years was a pilot phase where we were just seeing if Safe Care works, and we're getting some really great outcomes. And now with our fourth cohort, we have 13 sites that serve 41 counties and 2 tribal nations.
Often parents talk about having a manual. Babies don't come with a manual. People reportedly have cited saying, Safe Care is that manual that I wish I would have had.
The Fostering Healthy Futures program was designed by Dr. Tausig as an intervention for young children in foster care, and it makes a tremendous difference. These kids learn a variety of life skills. They also learn social support, and it's made all kinds of difference in terms of educational outcomes, and has now been adopted as an evidence-based practice and best practice in child welfare in many states.
Kempe continues to advocate and be a voice for children, tirelessly working to keep the needs of our most vulnerable population in front of the people who shape policy.
It is so comforting to know that they are only a phone call away, whether I need help hosting a conversation with my colleagues, or having extensive research done, or bringing an expert witness to testimony on a bill that may be before a committee. Having that here in Colorado is invaluable.
I was a social worker before I came to the state capitol. And so while I can give very true-to-life situations about how our laws affect our most vulnerable citizens, it's the Kempe Center that can talk about the solutions, the best practices, the statistics behind it, and bring in the experts to drive home my anecdotal points to make it real for people and actually change policy for the better.
And Kempe has never forgotten its clinical roots. Kempe sets the pace when it comes to treatments and technologies to help identify, prevent, and treat child abuse and neglect.
And we're really able to look at what's the next steps? You know, what is over the horizon? What are the cutting edge practice patterns and philosophies and technologies that we can bring to bear to this problem?
I think there's just so much potential here that we really are already recognized as experts in this field, but there's still room for us to grow. I want people to know when they hear the Kempe name, wow, those people are going to have the answers, and if they don't, they're going to want to find out the right answer.
There is great pride in the past and great excitement for the future. Kempe is committed to helping children, always.
The future of Kempe to me is continuing to be creative and innovative on how we prevent child abuse and how we treat children who have been abused.
The future of Kempe is leadership in child abuse pediatrics medical research.
The future of Kempe is training the next generations of medical providers, mental health providers, and social workers, and importantly, researchers in the field of child abuse and neglect so that we can do a better job 10, 15, 20 years from now than we're doing today.
The future of Kempe is promising.
The future of Kempe is engaging our next generation.
The future of Kempe is hope.